This is a 22-year-old male who attempted suicide by overdosing with lithium due to a financial crisis. He was found unconscious by his parents and was sent to the hospital. He has recent history of admission to a psychiatric hospital with an intense suicidal ideation. The man is unmarried, living with his parents, and he has lots of present concerns, including debt and working difficulty, workplace difficulty, with a past history of poor interpersonal relationship and academic stress. He considers himself a burden to the family. However, he still has a caring and supporting family with good relationship. But he still believes that he's helpless and hopeless, and he has irritability at work. He shows loss of interest in hobbies, etc.
So I'm going to share about the psychological effects. And John may have lowered emotional well-being due to depression, such as negative thoughts and emotions increases, the feeling of emptiness and hopelessness, and even loneliness. And they also may lack emotion control, and leading to frequent mood swings. And the temper of John will also be worsened, more irritable. And due to depression, he may lack desire. And this not only includes things that he used to enjoy, his past hobbies, and he may lack the desire to develop new hobbies. And he may lack sexual desires and thus sexual performances. Other than these, he may even lose the motivation to sustain his daily activities, such as eating, communicating, or sleeping, and things like that. And the loss of these desires may lead to eating disorders, social distancing, and also sleeping disorders, insomnia, so on and so forth. And the loss of desire to live may arise along the desire to commit suicide, and he may try to commit suicide or have suicidal thoughts, which are unhealthy for his psychological health.
Interdisciplinary cooperation is very important for the patient. There is a significant role for nurse. For example, nurse should firstly find out the nursing diagnosis for these patients, like risk for injury, risk for violence, impaired social interaction, ineffective individual coping, interrupted family processes, and self-care deficits. And then the nurses can find out the nursing interventions, like provide a quiet environment and to redirect violent behavior.
Thank you, Rebecca, for your comprehensive nursing management. And I'm going to talk about the pharmacological management. So the choice of agent actually depends on the presence of symptoms such as psychotic symptoms, agitation, aggression, and sleep disturbance. And the drug categories are listed below. Some examples are benzodiazepine, anti-manic agents like the drug our patient is using, which is lithium, and it is actually considered as a first-line agent for long-term prophylaxis in bipolar illness. And due to the refractory situation in our patient, I suggest to add on one more drug, which is a second-generation antipsychotic drug named paliperidone. It is actually used for refractory moderate to severe mania, alone or in combination with lithium. And another problem we have to take notes is the pharmacological compliance, which is poor in this patient. Our patient believed that the medication prescribed by us had kept him from waking up early, and as a result, he occasionally stops taking his medication. So I think we have to explain to the patient that there is no evidence that shows lithium will affect sleeping, and we have to explain to him that the difficulty in him sleeping is actually more due to the disease instead of the treatment. So if the patient is taking the treatment on time and with compliance, the problem of sleeping actually will go off.
For this client, I think both family counseling and psychotherapies would be helpful for him as well. Firstly, for family counseling, I think the worker could focus more on the stress coping strategy that was adopted by the client previously, which aroused some concerns from his parents. I think by grouping them together and talk more about this issue, I think the client could come up with a more appropriate stress coping strategy that is good for him, yet could relieve some of his parents' concerns. And also, I think both EFT and CBT would be helpful as well in terms of psychotherapy, as through EFT, the client could understand more about the meaning of his emotions and could be engaged and attended as well, his emotions. And also probably some more adaptive emotions could be replaced as well, so as to improve his overall emotional well-being. And for CBT, I think the client could understand more about how his current thinking pattern is shaped by his previous incidents and childhood experience, so that he could understand more about his thinking pattern and to see whether his thinking pattern could be changed to be more rational and adaptive through tools like cognitive restructuring and Socratic questioning method.
We've also come up with some community care plan for John, in which we can provide community psychiatric service and in which we'll have a case management program. And the case manager assigned to John will have outreach visit and crisis intervention, leads and supervise interdisciplinary care between the psychiatrist, the psychiatric nurse, the medical social worker, and the occupational therapist, etc., and provide individual care and connect with the community partners such as different NGOs and the Integrated Community Center for Mental Wellness in every district in Hong Kong. And for high-risk patients such as John, who is suicidal and requires crisis intervention, he will have outreach service once to twice a week by an intensive care team, which includes a doctor and a nurse, and they will carry out needs and risk assessments such as the risk of suicide, self-neglect, the mental state condition, and the compliance or adherence to treatment, and risks and any needs related to the social and occupational functioning. And they'll come up with an individual care plan followed by the intensive care team.